The overdose prevention and response teams were put into place to try and help businesses and office areas mitigate the concerns that people had, but more importantly, to help the people who were actually at risk of or were overdosing downtown.
We're coming up on 1 year of this program, and we've connected with thousands of people. We've been able to provide over 2,000 naloxone kits and trainings to people. We have reversed about 2 overdoses a week.
They wander around, they check different areas, they intentionally chat with people, they try and make some of those connections. It's all harm reduction, actually, at the end of the day.
You stay safe, eh?
The general population doesn't understand how many drug poisonings happen in this city.
There's people dying every day from opioid poisonings. We don't hear about it.
With the increasingly dangerous drug supply, and the fact that people through the pandemic were being cut off from different resources, we had more and more people who were experiencing fatal overdoses, but also non-fatal overdoses.
A lot of the supply that we see in Edmonton right now is not consistent. One time it could be cut with something like fentanyl, even the smallest amount, and not knowing that they're taking it could result in a death.
They were happening in places that most people hadn't expected, whether it was the malls or office buildings or pedways. And so there was nobody there to address that issue.
In 2022, we had 99 opioid overdoses in libraries across the city. So we were seeing very regularly people who were in distress in our spaces.
Boyle Street Community Services and the Downtown Business Association and the city connected, and through the City of Edmonton vibrancy strategy, we were able to fund a program. They look, we know what we're doing. We've done this before. We're very good at it, and we can help you. The teams work within the mall and the pedway system and the offices downtown. That was the origin. It has expanded out since then to include the library, also around the Sir Winston Churchill Square area, and a bit beyond as well. And also looking in some of the back alleys or the tucked away places that people may be found. They are connecting with people, they are referring people if they need to. They're very aware of what treatment options are out there for people if they choose to do that. The nurses are there to do some minor wound care or health assessments. And overall, if people are feeling like some of their needs are being met, just that alone will help decrease their risk of an overdose.
We become a big support for a lot of people by becoming on that first name basis and being somebody that folks can trust and confide in. We're able to kind of help people get to where they need to be.
Finding people where they are and letting them know what actually is available tends to actually increase the number of people using those services.
Everything that we do is looking at the evidence. So the team itself keeps very close track of everything that they're doing.
And then you can put how many community members, if it's an emergency response, and then all of our different healthcare services that we're providing.
So the data that we collect is used to kind of see the trends, how busy we are, what we're seeing, what we're needing more of.
We're very happy with the results so far. The program has been evaluated as well from the University of Alberta, but we do have a number of data sets that are telling us that we're doing the work that we need to do.
I hope you're okay. And come talk to us anytime. I'm here to listen, okay?
I funneled into harm reduction nursing because I'm a Métis man myself. So I thought this was like a really good way to reconnect with my Indigenous community, some of my brothers and sisters that aren't doing so well.
I would say the biggest problem that we face is the stigma around what we do. We get a lot of mean comments throughout our shifts just about people not necessarily understanding the full extent. We get a lot of people that assume we're handing out drugs to folks. That's not the case. We get a lot of people that just assume we're enabling people who use substances. That is also not the case. It's harm reduction based.
It doesn't encourage people to use drugs. Clean supplies encourage people to take care of themselves.
I truly believe they're saving lives.
The sooner my team can help someone, they are going to prevent longer term issues. Those are expensive, and they also take up time in a system that's really struggling to meet the demands right now.
Having nurses on our team has helped reduce some of the strain we see on the healthcare system in Edmonton.
I feel like it is very beneficial, like both economically And just like it's a more human approach.
When we have teams in all of the work that we do, we have a combination of a nurse with someone who's an outreach worker. Ideally, in our world, that outreach worker is someone with lived experience of substance use. They know things that nurses aren't taught in school.
Because I know when I was homeless and out here, I didn't get much support, and I saw it from that point of view, right? And once I saw those people that did have the compassion, that gave me the hope to get clean and sober. And then I was like thinking, one day I want to do this. One day I want to be out there helping the community as well.
A big portion of Edmontonians take things like transit and they frequent the downtown areas. So just keeping in mind that everybody's in a different place in their life right now and some people do need more help than others is a big start.